So thanks for sticking around. We have a lot more great information and education to be shared with the parents. We have Dr. Robb Phillips, who is going to be facilitating this session with some great panelists. And actually Chris, who was on the first panel, is going to join the second panel and talk about the work that he does. So I'll let Bob take over, and we are going to have the second part of this be interactive and have it be question and answer. So think about any questions that might be coming up for you. We're going to pass out note cards and writing utensils for you to write down your questions, and we'll be bringing it up so that we can get your questions answered. Thanks.
Thanks, Lauren. So this session really is about you. It's about the parents and finding out what resources we have in the community and what to do when you have a child who's experiencing behavioral health issues. We've had a panel with some wonderful teens and young adults who experience very different behavioral and substance abuse issues throughout their lives, and they could very easily be one of our children. So this is a good opportunity to hear from experts about what you do when you experience that problem. We've got 4 of them who, by virtue of the professional training, experience, or both, are here to answer your questions. They're each going to talk very briefly. And then please do pass your cards forward, raise your hand if you have a card with a question on it, pass them to the side. We're not doing that to filter. We're doing that because some people are very uncomfortable asking questions in a public forum, and we want everyone to feel comfortable getting their questions addressed. So we have with us tonight Dr. Adelaide Robb, who is the Chief of Psychology and Behavioral Health at Children's National Hospital. Dr. Robb is also a professor of psychiatry and pediatrics at George Washington University. She has studied and written extensively about treating ADHD, childhood depression and bipolar disorders, and the use of antipsychotic medication for children and adolescents. We also have with us Chris Bennett, who's the executive director of the nationally renowned intervention and consulting firm, Chris Bennett Interventions, who, as you heard earlier, grew up in Northern Virginia and experienced firsthand the challenges of adolescence and the destruction of addiction. He and his team have dedicated their lives to providing families in crisis with long-term solutions to mental illness, addiction, and behavioral changes. And Cristy Gallagher on the end here. Cristy is a tremendous resource for parents navigating the mental health system. If any of you have had to navigate the mental health system, even in Northern Virginia, it's not easy. Cristy's 12-year-old daughter was diagnosed with bipolar disorder, ADHD, anxiety disorder, and currently attends middle school in Fairfax County. Cristy is an outspoken advocate on improving the needs for mental health services for children, and she does that at the local, state, and federal level with groups such as the National Alliance for Mental Illness, or NAMI, and Virginia's Voices for Children's Campaign for Children's Mental Health. Cristy actually facilitates a NAMI parent support group here in Fairfax and recently helped us start one at Woodson High School. She also serves on local and statewide boards and committees focusing on children and mental illness. And then last but not least is Dr. Heather Tedesco. Heather is an applied psychologist who works directly with parents. She uses a combination of psychological research and proven techniques to help parents address concerns in their family life and support their children if they're struggling, and encourage healthy psychological development and authentic success. So each of our panelists are going to talk for 5 to 7 minutes. We'll leave time then at the end for questions. Do pass your questions forward to the side, raise them up, make sure we get them, and we'll get them answered at the end. And I think Lauren actually is going to put up a website that she'd like for you all to have access to right before we start the question and answer session, so stay tuned. Who are we starting with? Right? Cristy? Fantastic.
I want to start off thanking the Josh Anderson Fund for inviting me to speak today. This is a presentation that I've developed for a new NAMI program here in Northern Virginia called the Parents and Teachers as Allies program. It's just getting kicked off. And so if you like what you hear, please encourage your schools to bring our team of 4, usually have 3 or 4 presenters that come into the schools and can talk with the administrators, the teachers, and sort of talk a little bit about mental illness. My daughter was diagnosed with a mental health disorder when she was 8 years old. Most of the time, though, you would never guess that she has a brain disorder. She can light up a room and she walks in it. She's funny and can engage anyone in conversation. She's great with little kids and they all love her. She loves dolphins and the color teal and books and art. But she has also been diagnosed with bipolar disorder, a mental illness that makes her mood change and prevents her from always acting or reacting the way her peers do. You may not believe the story I'm about to tell you. Many people have a hard time understanding what it's like to live with a family suffering with mental illness. And as you can imagine, it took me a while to accept it and become an advocate for my daughter and our family. I, like many families going through what we have gone through, went through many stages of emotional reactions among family members dealing with mental illness. My daughter began showing signs that concerned us when she was 5 years old. She was diagnosed with sensory processing disorder when she was in kindergarten, ADHD when she was 6 years old, and anxiety, most likely caused by the medications she was on when she was 7 years old. The years between 2nd and 3rd grade were the most difficult for my daughter, our family, and her relationships at school. As we searched for an answer to why her behavior was the way it was, and for therapists, and psychiatrists that could help her, our family was in a state of chaos. Although at times her behaviors were happening in both the school and at home, we struggled with what to say to people about what we were going through. As we tried different medications that would work for her, she went through very violent rages, weeks of mania, insomnia for months, and times when she would harm herself or others in our family. During those long weeks of snowstorms in February 2010, Snowmageddon, my daughter was raging and had such mania that she made holes in her room and broke a window. The last straw for me was when she shoved her younger brother into a dresser and then asked him if he would jump out the window with her. That day we found someone to take our son, and then we drove to the emergency room with our daughter to seek help. She stabilized that school year, and we were finally able to obtain an IEP, or an individual education plan for her, for emotional disorder. But as we made another medication adjustment that summer, her behaviors worsened, and we again had to take her to the emergency room and for inpatient care. This was at the beginning of 3rd grade. I had many great experiences with her elementary school before this time, as they attempted to make adjustments to help her in the classroom and support our family. But when she was in the inpatient unit at a hospital in Washington, D.C., the school did not know how to handle that. When I was hoping to pick up my daughter's schoolwork for her, I ended up in the school's conference room with the principal, the counselor, her teacher, and the special education rep. I felt as I was being blamed for my daughter being in the hospital, and I was at a loss of what to do. It was humiliating, and at a time when I was really grieving for my daughter and her illness, I was made to feel guilty and ashamed. Luckily for my daughter and for our family, I was able to reach out to our school's social worker, and she was not only sympathetic, but able to help us secure a transfer to a school with an emotional disabilities program, as well as local funding for the Comprehensive Services Act, or the CSA program. I literally credit that social worker with saving our family and getting us the help we needed in crisis. My daughter recovered and began to thrive in her new school. The stability and support services that a program like a Comprehensive Services Center provided was a lifesaver. For the remainder of her time in elementary school, she had the ability to move forward at her own pace, remaining in a self-contained classroom when she needed to, and letting us gently guide her into the mainstream classroom when she was ready. Now she's 12, almost 13, and in middle school. She's also at a school that has a Comprehensive Services Center, where she benefits from all that they support offers. Although she's doing very well right now, for our family, our daughter's mental illness causes us to live in a life of instability. We never know when she might have another depressive or manic episode that will lead her to having a raging tantrum or several days of mania. She can go through periods of time when she will do very well at home and at school, but that direction can change at any time, and we are very sensitive to that. For me, letting the school be part of her therapy has also been very helpful. I spend hours of my time managing my daughter's treatment outside of school. Besides seeing a psychiatrist for medication management, she also has a psychologist. She goes to a social skills class. Her younger brother has had to see a therapist because he is experiencing PTSD from her. And my husband and I often go to a therapist as well. Under Virginia's Comprehensive Services Act, my daughter qualified through Fairfax County for services including intensive home-based therapy, parent training, and respite care. Last year, after my daughter came home from a month-long hospitalization, our family qualified for Wraparound Fairfax, where we received all of these services, plus an assigned facilitator who was assigned to our family and would host child and family team meetings at the school once a month. The child and family team was able to identify new needs, including tutoring for my daughter, the need for my husband and I to receive parent coaching, and recreation services for both of the kids. When we've had to put our daughter in the hospital, I was never really sure what to tell people. It's not like people sign up to bring casseroles to those who are inpatient in a mental illness hospital wing. Because of the support that she received from the school when she was in the CSA program, we were allowed the time to manage her illness and get the support we needed. As she went through recovery, we began to accept her illness, and I began to reach out for help. I began to speak out. When I went looking for a support group, however, there wasn't one, not one for parents of younger kids. So I started my own with help from NAMI. At our third meeting, 10 parents showed up. I learned that others were also desperate for support and information. As a parent, it's hard to believe that you would be put in a position to call the police to your home because of your child, but I've had to call them to our home twice due to the out-of-control and violent rages that my daughters experienced. I began to advocate at the state and local level for funding to provide a mobile crisis team for children experiencing mental health emergencies. Because of the funding that we've gotten from the General Assembly in Richmond, we now have one of those local mobile crisis teams here in Northern Virginia. One of the reasons I have become a mental health advocate and speak out on behalf of my family is to help educate others about what mental illness is and to address the stigma. I hope that if I can address it head on and do it at this young age for my daughter, that she will grow up accepting her illness and lead a life of recovery.
Thank you, Cristy. Chris, thanks for sharing your powerful story of your past. Can you tell us what you're doing now?
Absolutely, and again, thank you everyone for being here and for hearing me speak not only once but twice this evening. So I have an intervention and consulting company based in San Diego, California, and what that means is that basically families, we're pretty much the first point of contact a lot of times for families who are in need of services. So a family experiences a psychotic episode, a manic episode, a suicidal depression. They start to notice substance abuse or behavioral issues in their child. Most people don't say to themselves, you know what, we've got this really amazing plan in front of us and we know exactly who to call and who to go next and this and this and this and what it costs and who works with our insurance. Most families do not have that set up. And so we really are those people who have the resources that nationwide that families can contact us in the midst of crisis, and we're the ones who really are going to be walking them through, not only identifying the issues that are at hand, but also helping them to remain an objective third party. As I'm sure everyone experiences when we're dealing with mental illness and addiction in particular, is that there's a lot of emotions in a family. And it's very difficult to make great decisions when you're emotional. And so what we do is we really walk families through the crisis points, and we really help to create long-term solutions for families and plug them in with everything that they're going to need along that continuum. So that's what we do. You know, and I come from an interesting perspective here, being that I've had my own personal experience with addiction and mental illness. I've lost several people I've been very close to the disease of addiction, as well as mental illness in general. And you know, it's an interesting concept. I do a lot of research in terms of prevention and preventative measures, because you know, it's really one of the most effective tools with adolescents is prevention. You know, instead of having to eventually treat disorders, especially when it comes to addiction and substance abuse. Why not try to address them at early ages? And a recent study I saw basically said that 10% of families have conversations with their kids about drugs. That's incredible to me, you know. And I won't ask you guys to put your hands up by any means, but I'd be curious how many of you have had those conversations with your kids by the time that they're 10 years old, by the time that they're 13 years old, by the time that they're 16 years old. You know, and it's an interesting thing because those conversations don't happen for the most part. They're uncomfortable to have, right? So we don't want to talk about drugs. We don't want to ask our kids what they're doing. We don't want to, and one of the biggest things is we don't want to believe that this could be going on with our kid, right? So you look and you say to yourself, that can't, not my kid. Maybe that kid over there, but not mine. You know, and so much of that has to do with really the mission that, you know, Josh Anderson Foundation has set out for, is to start breaking this stigma around mental illness. And when we talk about mental illness, we're talking about addiction as well. So there's really no reason to differentiate between the two. You know, but the reality is a lot of times we're smacked in the face with the reality of behavior and we do not want to see it. You know, and it's amazing. My mom is actually in the audience today, so it's you know, interesting to have this conversation with her here. But I was in the position where I was sent to treatment. I was given the resources. I was given all the opportunities to do so. You know, and again, my parents recognized from a very, very young age, you know, 14, 15 years old, that there were significant issues going on. And these were not typical teenage issues that were happening with me. You know, and again, one of the things that I've talked repeatedly with her about is that, like, who was there walking her through these issues over the years? You know, and there were always temporary people. There was the person who could come in for the day and say, this is what we think Chris needs when he's 15 years old, and there you go. And they wipe their hands. But what about when Chris comes home at 16? You know, and what about when he fails out of school at 16 and a half and stops going to school? You know, again, there was really no one there that's going to walk them through all these steps and stages, especially in adolescence. You know, and again, that's really where I see, you know, in terms of what we do professionally, is really being able to walk hand in hand with families. You know, I come from a very, I guess, I hesitate to use the word innovative mind approach, but at the same time, I try to focus on how can we empower individuals to make changes in their lives. You know, having a mental illness in general is not a death sentence. And I think all too often I talk to families, in particular professionally, who say, well, my son has schizophrenia. And they expect that to mean that they're never going to be able to live a happy, successful life. My son has bipolar. My daughter has borderline personality disorder. And it's like they're basically saying, my son is on death row. My daughter is going to die of this illness. And so much of it is helping to educate families. And that's why I'm, you know, proud to stand next to somebody who's taken the initiative to start facilitating some NAMI support groups locally here. Because I know that on the West Coast and a lot of different places, we've got resources galore. And it's one of the reasons why I've wanted to repeatedly come back to Northern Virginia. Because I know when I grew up, my parents were blamed for my behavior. They were ostracized because they had a son who had an illness. You know, they were not a part of the community anymore. And I was pointed at, ooh, look at those bad people. You know, and I think so much of the reason why I see families that aren't reaching out for help, that they're not picking up the phone, that they're not contacting the school psychologist, they're not contacting a local therapist, they're not contacting somebody like me, they're not contacting a treatment center or a prevention group or anyone, is because of the fear that's behind it. And I have families ask me on a regular basis, you know, Chris, what should we tell our friends about what's going on? I say, do you want my real opinion? My real opinion is going to be that you tell them exactly what's going on. Because you know what? They're probably going to tell you that they know somebody, they're close to somebody, they have somebody in their family who's going through the same thing. You know, and that's the amazing part, is if I truly sat with each of you in here and said, tell me somebody in your family or your very close acquaintances that has a mental illness or a problem with substances, 90% of you would say, my uncle, my brother, my cousin, my nephew, my grandma, it's going to be there. So these are issues that are so prevalent in our society today, but yet we're still so afraid to talk about them because there's still such a social stigma around them. And so again, if I can just be, another person who shares my story, but also shares my experience professionally and being able to really walk families through, these challenges, these difficulties, and providing really the resources that are available. Because I think that's one thing, is it probably feels very isolative if you're out in the audience and say, my son, my daughter has this, and I haven't reached out, I haven't talked to anybody about it. You feel very alone, like you're on an island. And the reality is you walk into a NAMI support group, you walk into a Not My Kid support group, which is amazing that there's one called Not My Kid, is you find that there's 30 other family members who are going through the exact same thing you are, and that they found some type of solution in that.
And so realizing that it is a pressure-filled world with a lot of stress on our teens can help us to recognize that maybe they need some support. They're not always emotionally equipped yet to handle it. We know a lot about brain development and the fact that they're not quite ready. So while many of their stressors are due to factors outside the home, there are a lot of things that parents can do to help reduce some of those pressures when we can see that our kids are feeling them. One of the things I heard from the panelists earlier that really resonated with me is that it really comes back to connection. And so I would just make the point that kids need to feel unconditional love. And I know that all of us as parents feel this for our kids, but I also know from the research that not all kids experience our love unconditionally. And so there's a lot of misinterpretation by kids of the message. They begin to feel that we love them if they achieve certain things or when they behave in a certain way. And even though that's not the way parents feel, it can be difficult for kids to get that. It's also important for our kids that they know that we see them for who they really are. Our kids don't want to disappoint us, as we've heard so much tonight. And it's, they sometimes feel that, they should hide their flaws. And so the more we can explain to them that we love them, we see them who they are, and we love them, with their flaws and, because of their flaws. And to do that, it really takes a lot of open-ended questions, conversations with our kids. We need to ask them what they're thinking, what they're feeling. One of the panelists earlier mentioned that her mom said, tell me what I can do for you. Those kinds of questions are really helpful for our kids. Another quick point is just the idea of normalizing mistakes and failure, because as a culture, we tend to kind of give the message right now that mistakes could doom you. You put a foot in the wrong way in high school, and that can sink your entire future. And as so many of our panelists, and as we know as adults, life is unpredictable, and it takes a lot of twists and turns, and we recognize that. But our kids don't have the same, both brain development, executive functioning, and they don't have the life experience. So the more we can give those messages to them that, it's going to be okay, and that it's, failure is a part of life, and that if you're struggling now, things will get better, and talk about it and hang in there. The last thing that I really would like to just say is for us as parents to think about our own beliefs and priorities, because it's easy to kind of get swept up in this, zeitgeist about achievement and, this fear that, somehow we're going to let our kids down or we're not going to help them the best that we can. Our kids can feel that when we come from a place of fear, and so the more we can come from a place of confidence that, it's who our kids are that is going to make their future successful, whatever directions and twists and turns that it takes. And to give them a vote of confidence that we see them, we know them, we believe in them, we love them. These are things that can start to help. And so we need, as a culture, to prioritize psychological health the same way that we prioritize all the external achievements. And I think nights like tonight, I'm such a fan of the Josh Anderson Foundation for pushing this conversation, because we need to be able to talk about it. And the fact that all of you came here tonight gives you a wonderful opening, if you've come with your children or even if you haven't, to start these conversations, to continue these conversations, to make those connections that are so helpful for resilience and so helpful for psychological health. So thank you very much.
Heather, thank you. I know you didn't see it. You actually provoked an instance of unconditional love in the audience. I'm not going to say where because I want to embarrass them, but it was touching. Thank you. Dr. Robb.
Well, I want to also give my thanks to the Josh Anderson Foundation for having all of us come and talk. And I guess I have a little bit of a different perspective as somebody that takes care of a lot of the kids in Northern Virginia. And I have heard about all the suicides at one of the school, and it reminds me of part of why I started doing what I do. Before my 10th grade year in high school, I got a call at my house at 2 o'clock in the morning, and my mom woke me up and said, somebody wants to talk to you. I didn't have those kind of friends, perhaps like our other panelists did. I wasn't one of those up partying at 2 o'clock in the morning people, and it was a classmate from high school who wanted to kill themselves and wanted to talk to me before they did that so I could try and talk them out of it. And I didn't know what to do. I was a kid in high school. And I spent a couple hours on the phone talking to the person, and then they said, well, I have to go. And I thought, oh my goodness, I didn't know how to call the police. You didn't trace phones. When I was back in high school, it was a long time ago. You didn't even have cell phones. And I spent the next couple of weeks looking in the paper to see if anybody had died from my high school. And no one died, and then I decided that maybe I'd actually help somebody. I never figured out who it was. I never heard from that person again. And when I went off to medical school, one of the things I was very interested in doing was psychiatry, because I figured there had to be a better way to help people. And I ended up doing adult psychiatry and going to NIH and seeing all the bipolar kids as part of our bipolar research study. And parents kept bringing their kids in, and they'd be 6 and 7 and 10, and the parents would say to me, my child has bipolar disorder, and you need to help us. And I said, but I'm a grown-up psychiatrist. I can't help you. Go see the child psychiatrist. This is Washington, D.C., our nation's capital. You should be able to get treatment anywhere for your kid. And this was in the early 90s, okay? And what the parents said to me is, you don't understand, Dr. Robb, they don't believe in bipolar disorder in children. And there I was, prescribing medication for teenagers and younger kids that had not been FDA approved, that had not been studied in kids, and I wasn't a child psychiatrist. So I decided that was wrong, and I actually went back and became a child psychiatrist. And I've been working since '99, trying to help find and study better treatments for kids with bipolar disorder and schizophrenia and depression and ADHD. We've sort of done the gamut of studies, and we're still doing those in children's. But I think what it tells me is that we're not where we need to be. But if we all work together, we can advance the field. And I hear all the parents worrying about what's going to happen to my kids, and I heard the whole death sentence thing. And one of the nice things about being at Children's for 20 years now is I've had my 6-year-old patients that started out with ADHD running away from home in kindergarten graduate from college. I've had some of my depressed kids go to medical school and they're doctors. I've had other bipolar patients go to law school and they're attorneys in town. So I think when parents sit there and they're scared and they wonder, oh my goodness, is this a death sentence? I think one of the benefits of getting help when you're younger is all the bad stuff that happens from years of being symptomatic can be stopped if you get early intervention and early treatment. And I think that's the thing. I would say to the parents, if you're worried about your child, don't wait for the kid who doesn't want to bother you and is going to lie to the doctor. Tell you that they're doing okay. Say, I'm worried about you. And that may open the door for them to have that conversation with you rather than waiting for the crisis. Because what I really worry about and what we see quite frequently is the kid who got depressed and slowly sort of fell down the hill into the pit of despair, which is sort of how I think about depression. And they come when there's a crisis and they're in the emergency room having their stomach pumped out, or the belt taken off their neck and they're medevac to the shock trauma center. Ask them before that happens. If school's not going well, if they stop doing hobbies, if they stop hanging out with their friends, if something seems different, and you're all parents, you know your kids. If something seems wrong, ask them. Bring it up with your pediatrician. Ask your minister or your rabbi. Or just tell them we're going to the pediatrician, I'm worried. Get a blood test, get a tox screen if you're worried about substance abuse. It's easy to do, and even if they're mad at you, and I can tell you that teenagers with mental health care issues are mad at their parents quite frequently, it's all right. Just the way when they were 2 and 3 and they were frustrated and they were angry, they have a bigger vocabulary, but they still want your help. And I think we're going to leave time for questions. I'm not going to keep blathering because I could do it forever. Thank you.